Imagine having flashbacks or nightmares every time you hear fireworks or a car backfiring. Many of our neighbors don't have to imagine that. That's their reality. They suffer from post-traumatic stress disorder, depression, or anxiety. But some are finding relief from an old drug being used as a new alternative treatment.
I was able to just go out into nature and feel like myself and have a greater appreciation for life.
No longer run from challenges, see challenges as opportunities.
Bill Jordan suffers from severe depression. Lauren Mullinax has post-traumatic stress disorder and anxiety. Both say they can now function normally because of this, ketamine. Ketamine was originally developed in Belgium in the 1960s as an animal anesthetic. But these days it's being used more and more to treat humans suffering from psychological disorders.
A lot of research coming up for treatment of depression, anxiety, and PTSD.
The Food and Drug Administration approved the use of ketamine for humans in 1970 as a battlefield anesthesia for wounded soldiers in Vietnam. Ironically, doctors began using the term post-traumatic stress disorder, or PTSD, in the 1980s to describe the war's psychological effects on Vietnam vets.
A lot of our veterans suffer from severe PTSD, depression, anxiety. I've seen veterans who can't get out of bed, who can barely function, and any little trigger will set them off.
For several years, nurse anesthetists Levettis and Logan have used ketamine to treat veterans and others suffering from psychological disorders.
I see success rate of the ketamine treatment about 90 to 95%. We're pretty aggressive as a treatment. We have a lot of other options added to the ketamine that actually influence treatment of depression.
Things like multiple vitamins, B12, B3, magnesium, and oxytocin. So why aren't all medical professionals using ketamine for their patients suffering from psychological disorders? Because in most cases, it's not approved by the FDA for treating PTSD, anxiety, or depression. There are a growing number of studies that indicate ketamine provides both short-term and long-term relief for those suffering from PTSD, depression, and anxiety. But some in the medical community have their concerns, like possible addiction and temporary side effects. Ketamine is a Schedule III controlled substance because it can have hallucinogenic effects.
So how I explain treatments as morphing moments. So, you're sitting in the chair. I'm normally listening to music, my favorite songs, and it's almost like this roller coaster of thoughts, and it takes you to a different place.
It becomes a unique experience. Every time it's different. And I know at one time I thought, gee, I'd seen God, and God told me that whatever you're doing, it's not the right way. and he put that in my words, not his.
And it almost like wipes your slate, so to speak, so that you can handle things in a different way.
The patient's ketamine trip lasts about 2 hours. Research shows that ketamine has a significant effect on the brain's receptors that cause psychological disorders. They also acknowledge its promising effects on treating depression, PTSD, and anxiety. They're just not exactly sure how or why. What they do know is, for those who suffer from extreme depression and PTSD, a series of ketamine treatments administered and monitored by medical professionals in a clinical setting can change lives. Coming up tonight at 10, you'll hear more from Bill and Laura about their personal struggles and how they believe ketamine has saved their lives.